By August 2018, Ebola was long gone, but efforts to improve health delivery systems in Guinea, Liberia, and Sierra Leone were in full implementation. CH Rennie Hospital in Kakata, Liberia was one of the facilities that was hardest hit by the Ebola epidemic. Since September 2014, when the district-level facility reopened, health workers like Ortha Boué have been tirelessly working to improve care.
Like before, we have more patients delivering at home with TTM or TBA. As for now, they come for hospital delivery.
Ortha, a certified midwife, just received a patient who went into labor with twins. Health workers and essential medical equipment like this ultrasound machine help ensure babies aren't breached and mothers can have a healthy birth. Without them, the risk of complications during childbirth increased significantly.
So because of that, they tell the patients the importance of hospital delivery too, because we want to reduce maternal mortality.
Midwives like Ortha are a key link to building a strong health system. The knowledge and training she gained in her profession, she is using to train the next generation of health workers.
We receive more patients more than ever before because the people trust the health center now.
Liberia, for a long time, had one of the worst records in maternal and child care. One of our response was to promote the midwifery program, where women would be trained to deliver babies.
With the support of partners, the affected countries tackled the epidemic and redesigned their health systems to better prevent the spread of infectious diseases. But the challenge to improve access to care and the quality of care remained. The likelihood of a child surviving to their 5th birthday remained near the lowest in the world, as well as the likelihood of an adult surviving to the age of 60, an indicator which represents the overall health environment. In Guinea, Dr. Mustafa Grovugui is working with the Ministry of Health to transform healthcare by improving management and coordination.
Les voies sont en cours, les mécanismes sont déjà lancés, les outils ont été élaborés pour que le système de santé soit le mieux organisé possible en termes de planification et en termes de suivi des interventions de santé au niveau donc, communautaire, au niveau intermédiaire, donc les districts, au niveau régional et au niveau central.
To maximize effectiveness and improve service delivery, the health systems of Guinea, Liberia, and Sierra Leone have been designed with 4 levels.
Perhaps the most important thing that we have done is to start a program to train community health workers who would be first responders.
Community health workers are the first point of contact for families like the Banguras in Banga Wharf, Sierra Leone.
So if you are sick, I dey send call and they can't check me because they get the thing there for check more time. If na malaria or this, they check. If na malaria I get, they tell me say na malaria. He give me some tablets or he send me to hospital.
Community health workers have been mobilized to treat common sicknesses such as malaria, allowing health facilities to handle more serious conditions. As a second point of contact, community health centers have been set up close to where people live. This health center in Kent, a 10-minute drive from Banga Wharf, is where Salumatu can bring her family for checkups and more serious illnesses. Community healthcare has allowed Sierra Leone to improve service delivery and restore confidence in the healthcare system for families like the Banguras. This morning, Fatumata Berry noticed her son wasn't his usual playful self. Without hesitation, she put him on her back and walked about 5 minutes to the closest health center. As the Berries have done many times before to monitor the children's health, they undergo a free screening and examination. Following the examination, the doctor informs Fatoumata that her son has malaria. A common sickness in the region, Fatoumata's son is prescribed a medication that should cure him within 2 weeks. With the quick action by Fatoumata, the disease is caught early and can be easily treated. With support from the World Bank Group and international partners, Guinea is working to improve maternal and child health services. And access to primary health care is the cornerstone of a strong health system.
Le centre de santé a pour vocation de la prévention principalement. Nous avons des activités préventives et parfois des activités curatives, à savoir la vaccination, la planification familiale, le suivi de la grossesse des femmes enceintes, ainsi de suite. Nous faisons plus la nutrition des enfants.
To improve health services, the program recruits and trains health workers. This includes doctors, nurses, and midwives. Adama is one of the nursing students that does her clinical training at the Mamu Health Center. Excited to be working to help improve health services in her community, she is at a loss for words.
Seulement que je suis très ravie. Donc, c'est ça.
Il y a eu le recrutement de 200 agents, notamment dans la région de Farana, Labé et la région de Mamou, des professionnels de santé, et plus de 1500 agents de santé communautaire.
To support health workers in providing quality service, funding was provided to build and improve health facilities.
Cela nous a permis, dans un premier temps, de construire ce bâtiment qui va servir de maternité. Un centre de santé qui reçoit plus de 1200 femmes enceintes par mois qui n'avaient pas de maternité. Au lieu que les femmes n'accouchent à la maison, maintenant les femmes pourront accoucher au centre de santé. Et nous a installé un fourrage. Également le centre de santé, tous les points de prestation aujourd'hui ont l'eau. Du coup, l'agent peut à la fois laver ses mains avant de toucher le malade et après avoir touché le malade, il peut se laver les mains. Il y a quelques fontaines qui ont été données à la communauté. La communauté peut arriver au niveau du point d'eau, recevoir l'eau pour pouvoir utiliser l'eau du robinet au lieu d'aller utiliser l'eau du puits ou bien l'eau du marigot.
Hari men marandia, hari meden sonji moƴƴa, hari fi ndiyan ɗo ko men cipporo ha gaɗa leyga fi kolonji ha non joni Allah wulan ɗo wallimen min heeɓi pompiji kono joni min heeɓi ndiyam laaɓuɗam poy woni ɓe jarama barka maɓɓe.
Donc ce projet donc, a permis de réveiller, de redorer la confiance de la communauté dans les structures de santé et dans les agents de santé, mais aussi de soutenir tout ce qui est planification, avoir un meilleur aliment sur les nouvelles politiques de santé. Et tout cela a permis donc de reconstruire petit à petit le système de santé afin que ce système donc puisse répondre aux besoins des populations.
Put the baby on your chest, let the baby suck your breast anytime. Make sure you check on the baby. But the baby was born prematurely and then had the breast that is born with breast asphyxia. So the little infant was taken to the NICU, which is the neonatal intensive care unit, and placed in an incubator. For 14 years I have been here, there was no incubator. We had to farm our bags and then cover it with a blanket to provide heat. And each time we have to turn it to check on the baby. In between you breathe. Deep breath to remind the baby to breathe. Because they are small, they can forget to breathe.
And he's taking good care of me. Because the flower and when I want to be a lot family.
Because JFA is a tertiary hospital, and we receive a lot of premature babies, honestly, from various health facilities.
The maternal mortality has decreased drastically, and we believe it's once again having specialists, because when patients come to JFK, they have been through several clinics, they've come delayed, and they've come really ill, and you need emergency intervention. So having trained specialists has made a big difference.
Of my patient, he had a shorter duration, which was within 3 months' time when he noticed.
JFK is the original teaching hospital. So in the mornings, you'll see we have a handover and morning rounds where it's a mix of undergraduate medical students and also the postgraduate residents that are in training from the Liberia College of Physicians and Surgeons. And you have faculty, and normally there's a handover of patients, and it's a time to teach.
Excellent.
World Bank has been instrumental in funding the program and bringing faculty, much needed faculty, that have been able to train specialists, which have been able to provide services and improve the care of patients in Liberia. This is very important because as a teaching hospital, we are the #1 referral hospital. And when patients have no hope and no help anywhere else, they come expecting to receive help here. And fortunately now, we're able to offer them that care. A lot of procedures that cannot be done in other facilities are done here. Though we don't have everything, but at least we're taking the right steps in the right direction.
Having a medical school in Liberia and provided such a unique opportunity for us to study at home. And because not everyone has the opportunity to travel, to go to foreign medical school, so it was a good thing to have a local medical school that we could attend with the standard of education that could be comparable to other medical schools around the region.
5 years ago, after we redid our curriculum and got the World Bank involved in supporting the development of the labs and other things at the institution, we increased our intake from 25 to 50, between 50 and 60. So over the last 5 years, we had an average graduation between 35 and 40 students graduating annually.
We'll fully benefit and reap the results in years to come. Because we're training future leaders in healthcare. The specialists in turn will form part of the faculty, and they in turn will be able to train other specialists.
The situation has improved so much, not so much with improving the facility and the equipment at the hospital, but those young interns, those young doctors who are carrying the brunt of the service that's required and are doing it with such dedication. It's only a healthy people that can work, that can produce, that can have the attitude, the energy, the strength to carry out their functions and thereby make a major contribution to the society. You have to have a healthy people if you want to have a healthy nation.